Hello everyone, I'm Jill McLellan. I am the chair of the Surgical Sciences Department in the School of Veterinary Medicine at the University of Wisconsin-Madison, where I also hold the Tim and Nancy Speaker Chair in Canine Health. I am a veterinary ophthalmologist and I am a researcher with a specific interest in glaucoma in animals and in people. And today I've been asked to give you a taste of the research that we're doing in the Entlebucher Mountain Dog to try to define the genetic basis for glaucoma in your breed. So the objectives of the presentation that I'm going to give today are to give you a brief overview of the clinical presentation of canine glaucoma. I'm going to very briefly review the diagnosis and just touch quickly on the treatment of glaucoma so that you're aware what to look for and watch for. And also I'll review the current status of canine glaucoma genetics in general and genetic testing for this disease, and summarise some of our ongoing and future research strategies that we hope to overcome some of the barriers to identifying the underlying cause for the form of glaucoma that we see in your dogs. And also to identify how you might be able to help and contribute to this process. So I'm going to start by really giving you a broad definition of what is glaucoma. So glaucoma is actually the leading cause of irreversible blindness worldwide in people. And in people, it's been identified that intraocular pressure, so the pressure level within the eyeball itself, is the single most consistent factor that predicts your risk of going blind if you are afflicted by this disease. Now, in people, the disease is usually very slowly progressive, and we think of it as being the sneak thief of sight. So it sneaks up on you and you're not really aware that you're losing vision until you see your optometrist or your ophthalmologist and they identify that you in fact are developing tunnel vision. So what actually causes glaucoma and what causes this increase in intraocular pressure? Well, if we look at this cartoon on the right side of the slide, we can see a section where we've sliced through the center of an eyeball, and we're looking at this cross-section view through the side of an eyeball. And we can see the back of the eye where the retina, which is like the film in the back of the eye that takes light and turns that into visual signals, and the optic nerve at the back of the eye, which is the nerve that takes those impulses from the retina and shuttles them to the brain so that we can create vision from those impulses. And those are the structures that are damaged by the acute pressure rise in animals with glaucoma. But why does the pressure rise? Normally, fluid is produced in the back of the eye, sort of behind the pupil of the eye, and it is produced constantly and circulates into the front of the eye, in front of the lens and through the pupil, and then exits from the inside of the eye into the circulation through spongy-like meshwork, through spaces and drainage holes called the trabecular meshwork. Should normally exit the eye at the same rate that it's being produced. And in people and animals that have glaucoma, there's abnormalities of that trabecular meshwork in what we call the drainage angle that we can see just here. Abnormalities there are going to lead to an imbalance of production and drainage. So just like if you had a clogged sink drain and your faucet kept dripping, you are going to fill up that sink, and that sink is going to overflow because the eye is a closed system. It can't overflow, so the pressure starts to increase just like an overfilled water balloon. And it's that high pressure that is then going to damage the retina and the optic nerve. Now, in dogs, that increase in pressure is not like a sneak thief of vision. It doesn't gradually increase as it does in people. Boom, it just happens very sudden. So in most common forms in dogs, that glaucoma and the clinical signs associated with it are very sudden in onset. So I mean, you could go to bed at night and wake up in the morning and your dog could have lost sight in the eye because of a very acute, severe pressure rise. And indeed, the pressure increase that we see in dogs with acute angle closure glaucoma is often very, very extreme. And that pressure may fluctuate and go up and down, which is why a veterinarian measuring the pressure in the office, when you take your dog to the clinic, they may not actually measure a high pressure because that pressure goes up and down and up and down in some instances. Now, the signs that you will see that would indicate that there might be high pressure would be if you have a red eye. The eye is painful, so the animal will be squinting and your dog might be hiding or quiet or just not behaving as its normal self, might be off its food. The eye will tend to be cloudy, so a bluish grey in colour, a steamy appearance to what is normally the clear front of the eye so that you can no longer see the brown of the iris inside the eyeball. And if you're able to see inside the eyeball, you might be able to see that the pupil of the eye is dilated and very big compared to the other eye. Now, this pressure, as I've said, is blinding because it causes damage to the nerve at the back of the eye, it causes damage to the retina and cuts off the blood supply to those structures. And also it can be associated with varying degrees of inflammation that can make it a little bit hard for your veterinarian to determine whether the inflammation is a thing that's caused the glaucoma or whether it's being caused by the glaucoma. It can be difficult if, as is often the case, one eye is affected in advance of the other. So if the first eye is affected, you may not notice because the dog is able to compensate with the good eye. You might not notice that your pet has actually lost vision in the eye. Now, I have given you a link here. Purina have a magazine called Dog Update, and in the spring of 2019, we actually collaborated with their editor to produce a feature on glaucoma in dogs. And as we mentioned there, glaucoma in dogs can be quite difficult to treat. There can be drops that can be used to lower the pressure in the eye, which can be variably effective. And if those drops aren't working, then surgical intervention might be necessary. However, unfortunately, once an animal has had an acute pressure rise in the eye, the prognosis for return of vision and permanently keeping vision in that eye is actually quite poor. So an interesting thing about primary glaucoma, it's not actually present at birth typically. And usually animals are affected in midlife or from middle age on to later stages of life. So why is it that animals aren't affected till they're older? And that's because as we go through life, there are some changes in those structures, what we call the trabecular meshwork, that spongy structure with the drainage holes in the angle of the eye, at the front of the eye, where fluid exits the eye. And some of those changes can be worse in females. So in some breeds, though I haven't observed it in the Entlebucher, in some breeds it affects females about twice as often as it affects males. Other things that can lead to changes with age are the fact that the lens inside the eyeball gets bigger and its position changes as we get older, so that could potentially crowd and squeeze the trabecular meshwork structures where the fluid flows as well. So definitely there's some changes in the composition of the eye over time that are age-related that probably contribute to risk increasing as animals and also as people get older. Also, some of these changes and relationships of the structures in the front of the eye can be really quite dynamic. So as the pupil changes size in the front of the eye, and this could be due to effects of drugs that are given orally or by injection or as drops into the eye, lighting conditions and even excitement can cause the pupil to be larger. And as the pupil gets larger, that might also crowd these structures and reduce fluid outflow. But the role of inflammation, my experience looking at patients and at the eyes of dogs within your breed that have glaucoma, is that inflammation seems to play quite a big role. So what are the breeds that are affected by glaucoma? So as I mentioned, glaucoma can be a primary condition. So there's not really underlying conditions that are fully responsible and explain the development of glaucoma in some breeds. And in these breeds like the Cocker Springer Spaniel, Basset Hounds, Siberian Huskies, another breed that I'm studying, and obviously, of course, the Entlebucher Mountain Dog, we can see a clear increase in prevalence compared to other breeds in the general dog population, and that tends to imply that there is an inherited component, that there's some genetic predisposition that this breed has. We also see a much more slowly progressive, sneaky form of glaucoma in breeds like the Beagle, the Shar-Pei, and we call them open-angle glaucoma. They're also prevalent in those breeds, but we see this probably less often than we see the condition in breeds like the Siberian Husky and the Basset Hound. Now, I don't want you to think that only these breeds can be affected by glaucoma, because any dog can be affected by any type of glaucoma. We sometimes see mixed breeds of dogs that have primary glaucoma. And we sometimes see dogs like Basset Hounds or Siberian Huskies that have secondary glaucoma because they've got a tumour in the eye, or they've got infection in the eye, for example. So what about the breeds that are predisposed, that appear to be genetically predisposed? And important for me is that I really want to understand what's the underlying molecular basis. So what is wrong with the DNA, and what do those problems with the DNA cause in terms of the proteins and the structures in the eye? If I can understand the genetics better and understand the genes that are abnormal in breeds that are affected at higher prevalence with glaucoma, I've got a better handle on what is going on in the eyes, and so I would potentially be better able to help prevent glaucoma and to treat glaucoma when it does occur. So there's over 30 breeds with primary glaucoma, over 20 breeds that have something called lens luxation, mainly terriers, that can then go on and get glaucoma secondary to that. So that's a lot of breeds of dogs that have really quite high incidence. It can be more than 8% of those breeds that are estimated to have glaucoma. So unfortunately, in these breeds, we haven't been able to identify the underlying genetic associations. And that's probably because the genetics are very complex. There's multiple different things that are going wrong to give a perfect storm, if you will, that can lead to the glaucoma occurring. What I do want to say is that if we're able to determine that there is a really strong genetic predisposition related to just one or two genes, then genetic tests, particularly for the less complex Mendelian traits, we know from the advances that have been made in reducing the incidence of PRA in certain breeds, for example, those genetic tests can really work by informing how you breed your animals and make breeding decisions. It can be really important when you've got a more numerically small breed as you have. So what have been the sticking points, and why are we struggling, and why haven't we come up with tests as we have for PRA for glaucoma and for breeds that are affected? One of the problems we have is that it can be difficult to come up with a clean diagnosis. It's somewhat easy to diagnose primary glaucoma in a dog that's affected, but what we found very difficult is sometimes saying for certain that a dog that doesn't have glaucoma one day is actually an unaffected dog that can serve as one of our controls for genetic comparison with an affected dog, because your dog could be normal one day and then affected the next. And how we diagnose it is somewhat complicated as well. So we'll talk in a minute about gonioscopy, which I think is going to be very important and useful for your breed. But a lot of the time, the only way we can say for certain what the cause of glaucoma is, and that it is indeed a primary glaucoma, is to do pathology. We can't do that until the dog is affected. And the dog is affected so badly that the eye is really painful and blind, and the only course of action to control that pain is to remove the eye. So that's pretty much the only time where we have a definitive diagnosis of primary glaucoma. Now, obviously, this isn't very helpful because this is a disease that can affect older animals. So if we don't have a great test to say which animals will definitely be affected, how do we determine what our controls are? And also, how can we avoid using those animals before they've actually reached breeding age? Well, it can be very difficult and complicated and can be something that can be frustrating for veterinary ophthalmologists and for owners as well, is that these eyes can look very hot and very inflamed when they're affected. And so many veterinary ophthalmologists, unless you educate them that your breed is affected by primary glaucoma, many of them will never have seen an Entlebucher before, then they'll need to be educated that the inflammation they're seeing in the eye is most likely secondary to that primary breed-related problem that they have. The other things that we have are sticking points that are related to how we do genetic studies. So if we have breed structures where there's a lot of interrelatedness, as we see in many Entlebuchers and other numerically small breeds, is it can be difficult to tease apart genes that might be fixed within the breed and what the true association is with glaucoma. It can be difficult if multiple genes are likely all contributing to causing glaucoma, so that no one gene is enough to cause all animals that carry it to have glaucoma. And until recently, in particular, we were really restricted by the cost and the availability of extremely technical resources that are needed to determine the genetic sequences of dogs. And all of this has contributed to, if we didn't have the best data going into our computer studies, then you put garbage in, you're going to get garbage data out, which is why I don't give a lot of information about the genetic connections that I'm studying until I've really validated them and I'm sure that they really are playing a role in the disease. So I'm going to talk just briefly for a minute about gonioscopy. Now, gonioscopy is where we study the angle of the eye. So we're looking into that structure where that meshwork is to determine whether it looks like it's clogged or whether it's nice and open. So if you've got a low score, under the old scheme it was a 0, and under the current scheme we've now changed that so that it's a 1, then you'll just basically see that there's no meshwork that's really visible, and I'll show you some pictures of that. And then a 4, or a high number under the ACVO scheme here in the United States, indicates that you've got a nice open drainage outflow pathway that fluid can get through. So here we're looking again at this clogged trabecular meshwork, and we use a special lens on the eye because we're unable to see that just looking in with the naked eye or with a microscope. We need a special lens so that it's like looking around a corner with a periscope, so that we can look in and then look around that corner. And we can see here there's a normal angle where we've got open structures that you can probably just about make out here, like little teeth in a comb spanning a space. And then if you've got a severely affected animal that's got would have a very low score or a 0, you can see that we're not able to see those fibers, and all we can see is a single hole and then a sheet of tissue. So this would be a badly affected animal. But you can probably tell that this is actually quite difficult. It's not straightforward to see that, especially if you've got a wiggly dog. And I have to say that Entlebuchers are not the most patient when it comes to having gonioscopy done. As you can understand, this is not something that many veterinary ophthalmologists are a real fan of doing. It's can be quite time consuming to do. So this is something that's not part of the standard OFA exam, and you have to request that to be done. And because I've seen that these changes are not static, so as animals age, we actually see you can take an animal that looks really good and healthy when it's 2 years old, and by the time it's 6 or 7 years old, that angle can close off and the trabecular meshwork can become clogged. So that again is something that means that we really need to examine animals throughout life rather than just on a single occasion to say yes or no, they're affected or normal. Now, if it's so difficult and it's so unpredictable and it can change over time, what's the point in doing it? Well, I actually know that it can be useful in informing breeding schemes, and one breed that I have worked with when I was back working in the UK many years ago was a flat-coated retriever, and that was actually a breed that was my breed of dog, and I had a number of flat coats for show, and And it was very depressing to see a sudden increase in prevalence of glaucoma within that breed. And we were able to identify, and with colleagues in the UK, that if you avoid animals that have the most severe levels of drainage angle abnormalities on gonioscopy in your breeding schemes, you can actually reduce the prevalence of glaucoma. Because animals that have the factor of having abnormal drainage angles are the ones that are likely to, or have the potential to develop glaucoma. Notice here only 16% over 79 years in another breed in the Bouvier, which my colleague studied, over the course of their lifetime. It's actually a relatively small percentage. At most, 1 in 5 of them that have severe pectinate ligament dysplasia, which is the abnormality that we diagnose on gonioscopy, will go on and develop glaucoma. So what's important here is if you don't have abnormalities in your drainage angle, you're pretty much extremely unlikely to go on and get glaucoma, and certainly not primary glaucoma. So there's some value in terms of predicting from an individual patient basis or individual dog's basis what its risk is. And so now this can be challenging for a breed like the Entlebucher, where I acknowledge that because not only have we had the main bottleneck of domestication when dogs were, split off from the wolf and became domesticated many, well over 10,000 years ago, and then more recently over the past couple of hundred years where different breed structures started to emerge. Those are bottlenecks, and another additional bottleneck occurred in the sort of early to mid 20th century when Entlebuchers were down to a very small number of animals. And so most of the animals today all emerged from just a very, very limited breeding stock. So we have an extreme bottleneck, and some alleles that could be contributing to glaucoma could be fixed, and you might not be able to avoid those. But if there are multiple genes, are there some that we can avoid? Now, one of the first things we did was to look at some of the genes that we know are associated with glaucoma. These are the sneaky, more chronic forms of glaucoma in breeds like the Beagle and the Shar-Pei and the PBGB. And those don't appear to be the source of glaucoma in your breed. The Border Collie has a different genetic association, but it's not necessarily the gene that's causing glaucoma. It's just somewhere that's close to that gene, serves as a marker. And there's a couple of marker genes that are associated with a higher risk for glaucoma in an Italian Spitz breed, a little small breed called the Volpino Italiano that we can see a little picture of there. There has been an association between height and of stature. So short animals of short stature within a single breed that is associated with, that have genes associated with glaucoma, the shorter dogs are more likely to have glaucoma. And it's just something for us to bear in mind in the Entlebucher, where obviously they're a relatively long-bodied but stocky breed. So perhaps, conceivably, selection for shorter dogs at some point in the past may have contributed to the prevalence of glaucoma. So what can you do as breeders? I would encourage you, if at all possible, to help participate in studies. And we're going to be moving into a phase where we really are going to be wanting to collect samples, DNA samples from especially normal dogs, in addition to dogs with glaucoma. And this is where we've had problems, is we need to examine dogs that are older so that we know that if they were going to develop glaucoma, they've had time for that to happen, or had time to demonstrate that they were not going to be affected by glaucoma. So we've been looking for animals over 10 years of age that have normal angles on gonioscopy, get DNA from them. And it's been a real challenge that took about 18 months for us to get about 6 dogs that met those requirements. Please consider us and consider having gonioscopy done in your older dogs, and reach out to us to participate. Another important thing that you can do is you should be well informed so that you can be vigilant, and also so you can inform and educate the owners of dogs that you produce and primary care veterinarians that this is a problem in your breed. And not only that, glaucoma is an emergency. So if you notice a red, cloudy, painful eye in an Entlebucher, you don't think, well, maybe it's a scratch. We'll see what it's doing, how things are doing tomorrow. This is an emergency, and so animals really should be examined as quickly as possible. And the pressure needs to be measured in the eye, and that pressure needs to be treated within a few hours of the problem arising, because that window of opportunity for treatment is relatively narrow. Now, also be aware that you may need to inform ACVO diplomates, and you'll be able to give them links to my website, put them in touch with me, and you can explain to them that this is a breed that does have a problem with primary glaucoma. Another important thing is a specialist should really be involved, because it's important for you to identify an animal that has primary glaucoma in one eye, because even though they aren't affected at the same time, almost always that second eye will be affected, leading to complete blindness and potentially loss of both eyes. So it's certainly something that we will usually start medical treatment even before the pressure goes up in a second eye, once we've identified that it is at risk of primary glaucoma. So if you want to participate in the studies, we're always looking for DNA samples from animals that have had gonioscopy. Although it can be difficult to contemplate, we're looking for donation of eyes, that we can compare the pathology between normal eyes and eyes with glaucoma, and the expression of genes and proteins to help us sift through the very large number of genetic differences that we might see between our control dogs and dogs that have given us DNA samples from glaucomatous animals. So that's something to bear in mind. When you lose your beloved dog, please consider whether you'd be prepared to for your dog to serve as a donor in this respect. And with that, I'd just like to thank you for your attention. Sorry, I've gone over time a little bit. I'd just like to thank all of the dog owners and all of the breeders, and especially the dogs that have contributed to our studies so far. We are really close now, and I'm hoping that within the coming months that we really will have some additional clues. I've circled there the sources of my fund, in particular the AKC that have given us funds to conduct this study and do the DNA sequencing in the Entlebuchers. We're probably not going to reach the end of our study and have all the answers, but it's going to hopefully take us quite a long way towards understanding this horrible disease.